Hi there, it's Dr. Karen Leggett, the Women's Midlife Specialist, and today is part 5 in Be a Superwoman Breast Cancer Brainiac. And in today's video, I'm super happy to present to you blood sugar and diabetes. How sweet is it? In this video, you will discover the #1 dangerous trend that midlife women face that cause them to increase their risk of diabetes and breast cancer, and how to avoid this dangerous trend. In the last 25 years, there has been a worldwide increase in diabetes by over 300%, with over 422 million people with diabetes worldwide. 29 million of these are Americans, and 90 to 95% of these people are type 2 diabetes. Now, this isn't counting pre-diabetes. In America alone, there are another 86 million people with pre-diabetes. Diabetes is now the 7th leading cause of death in the United States. All of these astounding facts point to a really big problem when it comes to breast cancer because there is a known link between type 2 diabetes and breast cancer. Studies show that postmenopausal women 50 years or older who have type 2 diabetes have about a 20 to 27% increased risk of breast cancer. And to make things worse, women with type 2 diabetes who develop breast cancer end up having a higher risk of dying from the breast cancer as well. Fortunately, type 1 diabetes has not been shown to have a higher risk of breast cancer. Now, in just a moment, I'm going to introduce to you my granny, who is the sweetest grandma anyone could ever have. And my little sister wants to meet you too. But before they say hello, let's go a little deeper and talk about the #1 dangerous trend midlife women face that will increase their risk of diabetes and breast cancer: hormone imbalance. There are 5 main hormones involved that can increase your risk of breast cancer when they are not well balanced. A way to remember the hormones that come into play with type 2 diabetes is by remembering the phrase, "I can do everything." In type 2 diabetes, the problem starts with an important hormone that comes from the pancreas called insulin. Insulin is responsible for helping sugar that is in the bloodstream get inside of your cells so the cells can use the sugar to make energy and perform daily cell activities. But in type 2 diabetes, the pancreas doesn't produce all the insulin your body needs. And in addition to that, the cells in your body pay less attention to the insulin you do have. This lack of response by your cells keeps the sugar out into the bloodstream instead of getting inside the cell, so the cell can function properly and make energy. This is how the sugar levels rise in your bloodstream. It can't get inside the cells where it's needed. What happens next, though, in the body is really quite smart. The brain recognizes that the cells aren't getting the sugar they need, so the brain signals the pancreas to try to release more insulin. But this doesn't help that much because the cells still resist the insulin and still refuse to allow the sugar to enter. So not only do the blood sugar levels go up, but now the insulin levels in the blood go up too. And these elevated insulin levels and blood sugar levels cause inflammation to build up in the blood vessels. And the inflammation is what causes the breakdown of healthy cells and the onset of many medical diseases, including cancer. Now, it doesn't stop there, because elevated insulin levels start working negatively on two other important hormone-producing organs: the adrenal glands and the ovaries. The adrenal glands make cortisol and other hormones like DHEA. Both of these hormones are very important hormones to keep our bodies healthy, but problems occur when they are out of balance. First, because elevated insulin levels cause inflammation, the adrenal glands are turned on to start making cortisol, because cortisol decreases inflammation. But there are more problems when cortisol is overproduced. Cortisol causes blood sugar to rise even further, which stimulates even more production of insulin. It is another hamster wheel that is difficult to get off. Then, elevated levels of insulin also turn the adrenal glands on to produce more DHEA. When DHEA is balanced, as it should be, it is a very important hormone for strong immune function. But DHEA also converts to estrogen and testosterone. When DHEA is balanced, this conversion to estrogen and testosterone is great and helps keep our estrogen and testosterone at healthy levels as well. But when excess DHEA is produced from rising levels of insulin, the levels of estrogen and testosterone will rise too. And it doesn't stop there either, because testosterone can convert to estrogen too. And this imbalance of estrogen may increase your risk of breast cancer. Now, while all of this is happening from the adrenal glands, elevated insulin levels influence your ovaries too. Elevated insulin levels directly stimulate the ovaries to release even more testosterone. And as you have just discovered, testosterone can convert to estrogen, increasing your estrogen levels even further. Do you see now why it is so important to have balanced insulin levels? So how do we bring insulin levels down? There are three main ways to bring your blood sugar levels down, thereby decreasing your insulin levels and all the resultant hormone imbalances. Think men. M-E-N. Let's start with number 3 and work our way down to number 1. The third way to bring your blood sugars down is through medications. Medications are an important part of getting blood sugar levels and inflammation under control. If you have diabetes, this isn't the time to try to go natural all at once. Diabetes is like being on a hamster wheel that won't slow down long enough to get off. Medications will slow the hamster wheel down so that lifestyle changes can start working. I tell patients, you don't have to take medications forever if you also do some simple lifestyle changes. There are many great medications now to treat diabetes. Different people respond to medications differently. So if one isn't doing the trick for you, bring your blood sugar diary into your doctor and ask for more help. If you have diabetes or even pre-diabetes and your blood sugar isn't under great control, tell your doctor that you want to come back to see him or her in 1 month. A month is plenty of time to see if a medication is going to work well enough or not. Also, knowing that you're going back to the doctor in 1 month will keep you more accountable for lifestyle changes, and 1 month is the perfect length of time for you to see the benefits of your efforts. Just 30 short days, 4 short weeks. If you stay focused on your lifestyle changes, you will make progress. This leads to the second way you can decrease your insulin levels, thereby decrease your risk of diabetes and breast cancer. It's the E in men. You guessed it. Exercise. Now, I'm not talking about strenuous exercise, just plain old moderate exercise, like enjoyable walking. Strenuous exercise can make things worse by increasing cortisol, which can actually increase your blood sugar. Exercise makes your cells more responsive to insulin, and then when you do moderate exercise like walking, your heart beats a little faster and you breathe a little harder, and your muscles can take up more sugar to make energy, and then the sugar levels in your blood go down. And guess what? The cells keep taking up sugar for hours after your walk is over. You see, exercise is a very important part of the big picture. Now, I bet you can guess what the number one thing is that you can do to lower your insulin levels and thereby decrease your blood sugar and your risk of breast cancer. That's right. You got it. The N in men is nutrition. When you eat the right amounts of macronutrients, protein, carbohydrates, and fats in the right proportion, your body does the rest of the work for you. In fact, if this is all you did, improve your nutrition, your blood sugar and insulin levels would decrease on their own, even without exercise or medications. That is why your nutrition really is the number one thing you can do to reverse high insulin and blood sugar levels, bring your hormones back into balance, and lower your risk of breast cancer. In fact, if you're fortunate and discover that your blood sugar levels or insulin levels are just beginning to become elevated, this is an extremely easy way to get things under control in just a few short weeks or months. It's amazing how fast and effective changing the way you eat changes your hormones. Honey, come get your dinner. I fixed you your favorite dinner, chicken and mashed taters. Come and get it. And if you eat all your mashed taters, I fixed your favorite dessert, chocolate cake. I just love that little granddaughter of mine. She's such a sweetie when she comes a-visiting me. Oh, thanks, Granny. Looks great. Yummy. Mmm. Mmm, yummy. Mmm. Mmm. Granny, I'm all done. I'll be right back. I have to go to the bathroom. Why, look in there. She plumb finished all her mashed potatoes like a good little girl. I'll just leave this cake right here for her. Granny, I feel a little tired. It looks like my little sister needs a few lessons on nutrition herself. Well, that's what we're going to cover in part 6 in this series on breast cancer, when we learn about the influence nutrition has on your risk of breast cancer. So stay tuned for a fast, easy, and simple outline to get your nutrition up to speed to decrease your risk of breast cancer and diabetes. And guess what? The same principles that help prevent breast cancer and diabetes will also help you lose weight. I hope you learned something from this video today. Now, would you do me a favor? I really enjoy reading the comments you leave me down below this video. Could you scroll down and leave me a comment now? Let me know what you struggle with most. See you soon. Bye-bye.